Hey, this is Curtis Alexander. I'm a pharmacist. In this video, we're going to be talking about Tamsulosin, also known by the brand name Flomax. Kind of give an overview of the medication, talk about how it's dosed, talk about side effects, warnings, pretty much everything you need to know before you take it. And before we hop into it, my website's curtis-alexander.com. Free report there for you. You want to check that out. So, starting off here, what Flomax does when you take it, it actually will go into what are called your alpha-1 receptors in your prostate and the neck of your bladder, and it essentially blocks those. And what we get is that when it relaxes those muscles, you'll see an increased flow of urine and decreased symptoms of benign prostatic hyperplasia. And what that is basically prostate issues. So you'll see a decrease urine flow. A lot of guys have trouble getting the urine flow started. They can't completely empty their bladder. Even though they feel like they have to go pee, they can't empty the bladder. There's leakage afterwards. So a lot of urinary issues that go on, so they'll start them on Flomax. And so as far as starting, the doses that we normally see, you're going to start out at 0.4 milligrams once a day. After 2 to 4 weeks, you can, if the symptoms aren't resolved and we're not getting the results we're looking for, we can bump those folks up to 0.8 milligrams per day. Now, something important to keep in mind, if you interrupt the dose, if you miss a few doses, or if you discontinue the medication, you're going to have to go back to the drawing board. Most of the time, we're going to have to start those folks back at the 0.4. So it is important. We don't want to be missing doses with the Tamsulosin, okay? Now, there are some folks that we want to be careful starting Tamsulosin on. Number one, we want to pay careful attention to anybody with heart issues. So if you have angina, if you have heart failure, that's a group of people that we want to be careful with, because when we block those alpha receptors, we can see a decrease in blood pressure, we can see increased risk and concerns for heart attacks. So that's something to keep an eye out for. Sulfa allergy. Okay, if you've had a severe sulfa allergy where you have difficulty breathing, extreme rash, Flomax is not something you're going to want to do. People who've had those kind of true sulfa allergies, Flomax is a concern. Cataract surgery. All right, so what we see is, I think it's called like droopy iris syndrome. There's some sort of, I'm not an eye doctor obviously, but there is a condition where they'll go in to do a cataract surgery, and when you're taking Flomax, it increases the risk for that droopy iris syndrome. It's not going to change the fact of them doing the surgery, because they've looked at it before and have been like, okay, if we stop people from taking Flomax and then have them get cataract surgery, it doesn't appear to change things. But from what I understand, ophthalmologists, those types of folks, eye doctors, it may change how they do the actual procedure. So you will definitely want to let your eye doctor know that you're on Flomax. And the next group of folks that we have to be careful with is if you're 55 to 75 and up. What we can see is a decreased metabolism of Flomax in your body. As we age, sometimes those things slow down, and it does with Flomax. So AUC is the area under the curve. That's a fancy pharmacy way of saying we have much more drug in the system. Much more meaning upwards of 40% more of the drug in the system in that age group. So we definitely want to start out the 0.4 range, be very careful moving up, okay? Let's talk about side effects. I'm just going to give you the top 6 here. Right off the bat, we have headache, again, probably related to the orthostatic hypotension that we see next. So headache, 19 to 21%. Interestingly enough, with orthostatic hypotension, so that's when you stand up and your blood pressure drops rapidly. With chronic use, 16 to 19% incidence of that orthostatic hypertension, but even a 6 to 7% incidence of that happening with somebody's first dose. So be careful about that, okay? Dizziness, 15 to 17%. Ejaculatory failure, So many guys that start on this medication have trouble in the sexual department, and you hear about it fairly frequently. So if your guy, it's something to be aware of. It can cause sexual issues, this being one of them. Okay, 8 to 18% on that. Rhinitis, so basically cold-like stuff, 13 to 18%. And then finally, infection, kind of related to the cold, at 9 to 11%. But usually the two biggest ones I see we could lump together: the headache, orthostatic hypotension, dizziness, kind of related, then the ejaculatory failure. Okay, what about foods? Do we have to be careful about how we take it? Yes, we do. If you're into, a lot of people, and I used to be, I no longer do it for various reasons, but fasting, okay, that can actually change, and it will increase the bioavailability. That's how fast and how much of the Flomax that you're absorbing. Fasting increases it by 30% and increases peak concentrations by almost 40%, upwards of 70% in some people. So that's why we recommend take it about a half hour after a meal, so you have some food in your stomach. Otherwise, levels are going to jump way up, okay? And I do want to bring something up, because sometimes when people start taking this, they'll be like, hey, you know, I got dizziness in the morning. I felt like I was lightheaded in the morning. Pardon me, can I take it in the evening? The answer is yes. Time of day isn't really a big deal with it. And as a matter of fact, it helps people sometimes to move it if they're having those dizziness and orthostatic hypotension issues in the morning. Move it to the evening, take it after supper, and then go to bed. Tends to help. How about alcohol? Okay, I got to be straight up honest with you. I know people on Flomax, they drink, no issues. But the formal recommendation is that you not do that, because we worry about that orthostatic hypotension that keeps popping up, okay? Tread lightly if you want to have a drink when you take Flomax. Get used to the medication first, and then just base it off how you feel. But technically, no, it's not a good idea. Do people do it? They do. Just please go slow with it, okay? Let me know in the comments, have you taken Flomax? Do you know somebody who has? Did it work for them? Did they experience side effects? The comments are really helpful for me, even more helpful for other people that are watching the video to know, you know, kind of get some feedback from somebody other than myself. So I hope the video was helpful. And again, let me know in the comments if you know anything about Flomax, taking it before, that sort of thing. And until the next video, thank you.